I'm Debbie Zellman. I'm president and founder of Debbie's Dream Foundation. And why am I here, right? I was diagnosed at the age of 40 with stage 4 advanced incurable stomach cancer. I had no risk factors of the disease, no thoughts that I could possibly have stomach cancer. And the 5-year survival when you're diagnosed with stage 4 stomach cancer is only 4%. I actually founded Debbie's Dream Foundation, Curing Stomach Cancer, to help the so many who don't respond to the chemotherapy that they're given. So our mission is to raise awareness, to fund research, to advocate for more research funding, and to educate and support patients, families, and caregivers internationally.
This is a challenging time for my family, learning that my 17-year-old actually has stomach cancer now, and how quickly we had to move towards the next steps of having a total gastrectomy. And in the midst of all of that, Debbie's Dreams was getting ready to do their 8th trip to Capitol Hill. And while I've watched over the last few years as they've done that, it for me had not been a consideration, and I'm not exactly sure why. But in the midst of the chaos going on in my house right now in preparation for what's happening next week, something compelled me to want to be part of this particular trip.
And I actually have 2 sons with stomach cancer.
2? Wow.
Yeah, I lost my 20-year-old in 2015.
Wow.
Thank you. And we learned it was from a genetic mutation.
I'm excited to be back here today, and the group is quadrupled in size, and it's absolutely amazing. The energy, I just feel the energy.
We're about to attack the Hill and meet with our congressional delegates to support additional funding for stomach cancer and to raise awareness.
We're in a pot of money competing for cancer dollars. And one of the things that the criterion is the potential for scientific discovery. What can you discover? It is much easier to show what you can discover when you know more. So we don't know as much, and because of that, it's easier for a cancer who has money to get more money.
We're here with Debbie's Dream Foundation, try and increase funding for gastric cancer, which is a horrible, horrible disease. It affects so many people, and it affects not just the patient, but their entire family.
So my dad, he fought very, very hard just so he could get as much time with us and family and all of his friends. So he did that just for us.
I think he'd just be super, proud that we're out here and trying to just advocate for this and try to help other people.
I wanted to come down and talk with Congress people to show them why they should fund stomach cancer research, because I am one of the few where stomach cancer was found early and I'm doing really well, and I wanted them to see that their investment in stomach cancer will mean something.
Debbie's Dream Foundation does an amazing job helping you along the way to tell you exactly what to say. They're a family. They're going to offer you the support. They're going to help you to know how to make those meaningful and impactful, and so that we can make a difference, so we can have more survivors like Nicole.
Being here has made me feel a lot better, and knowing that others are going through the same things I am, and just not feeling isolated, being able to have someone to talk to about what they're going through at the time that I am, and just having that commonality and learning that there's a lot of other folks going through walking in my shoes, or vice versa, and it gives me hope.
For our organization and for others like ours, I feel that the best way to accomplish a larger goal is to unite and join together and share resources and information so that we can make a greater impact. I found my wife and we married, and 5 years later, her brother is diagnosed with stage 4 stomach cancer and also a CDH1 positive, and I happen to be in a position where I can provide a multitude of resources and information that otherwise he may not have been able to find or understand.
I had these intense side effects to hot and cold. I couldn't drink anything unless it was room temperature. I couldn't go into the refrigerator without putting on gloves. I couldn't wash dishes, so I guess that was good in some people's eyes. Until you get those words, you have cancer, as much as you may say you understand that life could be short, you now know life is short.
I asked him, I said, "What do you think it is?" And there was a long silence, and he said adenocarcinoma, which is cancer. As a physician, our mantra is first do no harm. I live every day thinking that I harm my brother. I think now, working with Debbie's Dream Foundation, and after experiencing so many positive interactions, not just among the community of Debbie's Dream, but the congressmen and women that we met with and their staff, and how compelled they felt to want to help us, give some meaning to this horrific loss in my life.
everybody. My name is Andrea Eidelman, and I'm the CEO of Debbie's Dream Foundation. I would like to welcome you here today and thank you for attending and learning more about Debbie's Dream Foundation, the work that we do for the community, and learning more about stomach cancer. Next slide. That is me, Andrea Eidelman, the CEO of Debbie's Dream Foundation. Next slide. So our mission is to raise awareness about stomach cancer, to fundraise, to fund research for stomach cancer, and to provide education and support to patients, families, and caregivers internationally. Our ultimate goal is to make the cure for stomach cancer a reality. Next. Pictured here is our founder. I know people were asking me if that was me, and it's not. That's Debbie Zellman, who was diagnosed in 2009. After she was diagnosed, she started Debbie's Dream Foundation 1 year after, when she was diagnosed with stage 4 incurable stomach cancer. Debbie was a mother of 3, a practicing attorney. She had no risk factors or symptoms for the disease that were very mild. At the time of her diagnosis, she was given a 4% chance to live 5 years. She fought for 9.5 years, facing many reoccurrences and harsh treatments. When she was diagnosed, she was very surprised to learn that, contrary to cancers like breast cancer and colon, there were very few resources available for stomach cancer. So she made it her life mission to help those that were also suffering with the disease. Unfortunately, Debbie passed away December 23rd of 2017, but her legacy continues through the organization. Next. To date, we have funded $1.2 million in research for gastric cancer. We partner, thank you. Thank you. We partner with the American Association for Gastric Cancer Research to offer grants for basic translational and clinical research for stomach cancer. The AACR ensures that all research proposals are put through a peer-reviewed process and criteria throughout the length of the grant. Next slide. So today I'm going to be talking about the different programs that we offer our patient community. We offered many free programs to the gastric cancer community. And these are some of our ongoing initiatives. Our PrEP program, our symposia, our webinar series, a nutrition education program, and our health equity program, which today's event is part of that. Next slide. PrEP is our largest program that encompasses the general mission of the foundation in providing education and support internationally to patients and their caregivers. The PrEP program includes our mentoring program, our advocacy and outreach in the community, our virtual monthly support groups, our Dream Makers Miracle Fund, our clinical trials matching services, and an online support community. Next slide. As part of the PrEP program, we are able to connect those feeling alone with their diagnosis with others who know exactly what they're going through. Our mentoring program provides patients and their families, patient, survivor, and caregiver mentors based on age, location, stage of cancer, and biomarkers. Our monthly stomach cancer support groups are led by a licensed clinical social worker and are a huge resource for newly diagnosed patients. We also have an online support community where patients can remain anonymous and seek support and guidance from each other. Next slide. Under PrEP, our Dream Makers Miracle Fund that launched in 2020 was a new initiative where we were able to grant wishes to patients and their families to create lasting memories. Here are some pictures from our award winners. The Feast family went to Disney World, and Joey Feast was diagnosed at age 17 with stomach cancer. 6 years ago, his brother died of stomach cancer at the age of 20, so cancer has affected their family tremendously. We were also able to grant Kenny Ricard his bucket list wish of skydiving, which was featured on the local news. In addition, we were able to provide gifts to children 18 years old and under through the holidays through our toy drive. We look forward to providing these similar experiences to our stomach cancer community in the future. Next slide. As part of our mission, we advocate for early detection and provide community education and support to physicians, nurse navigators, hospitals, legislatures, and disparate communities affected by stomach cancer. We also have 32 chapters throughout the states and overseas who are strong advocates and spread awareness to their local community about this cancer. Next slide. Each year, patient advocates come together at our annual Debbie's Dream Advocacy Day in DC with the goal of securing funding from the Department of Defense's peer-reviewed cancer research program, which specifically allocates federal funds for stomach cancer research. This year, 132 patients and caregivers advocated to virtually, because we couldn't go due to the pandemic, but they met with lawmakers, shared their stories, and pushed for more federal funding. To date, through our Advocacy Day, DDF has been able to increase the amount of federal funding to $115 million, which partially is allocated for stomach cancer research. Next slide. We also host successful symposia throughout the year. One international symposia, which was held in South Korea virtually last year, and one in-person symposia hosted at the Mayo Clinic in Minnesota, This year, we launched our series of symposia on February 9th with a virtual event moderated by Dr. Jeremy Davis of the NIH, National Institute for Cancer. The event highlighted the latest research in gastric cancer treatment. And later in June this year, we will be traveling to South Korea for this year's international symposia. And in August, we have a symposia right here in Miami in partnership with the Miami Cancer Institute. Next slide. We also host informative webinars for our gastric cancer patients and caregivers throughout the year. This year's series launched on February 25th, featuring Dr. Brian Badgewell from MD Anderson, discussing the possibility of curing stage 4 stomach cancer. In March, Dr. Zev Weinberg, a professor at University of UCLA and a co-director of the UCLA GI Oncology program, spoke on immunotherapy and targeted therapies for gastric cancer patients. In April and November, we will continue our webinar series with our Rutgers University speakers, highlighting various resources and the work being done there for the gastric cancer community. And in September, we will always host, as usual, any updates on clinical trials and treatments. Stomach cancer patients and caregivers need simplified answers to help them maintain proper nutrition post-diagnosis and post-gastrectomy. We offer education around nutrition through our webinar symposia, recipe books, and content from our website to help empower our patients. This year, Emmy-nominated Chef Nathan and clinical oncology dietitian Mary Eve Brown will lead this year's cooking demonstrations, preparing delicious meals that are modified for gastric cancer patients. Next slide. Last year, we launched our Health Equity Program, which raises awareness about the disparities that affect the Black, Indigenous, and people of color populations. To address some of the gaps in healthcare, this specific program provides our clinical trial matching service, informational webinars, live chats, and more. DDF is also doing community outreach in partnership with other organizations to specifically serve these disparate communities. In addition, we feature various stats that highlight the inequities in healthcare for the BIPOC communities and also offer translated materials and programs in English, Spanish, Creole, and Korean. You can learn more about these resources always on our website at www.debbiesdream.org/health-equity. Next slide. Also under our Health Equity Program, we launched a stomach cancer hotline in partnership with Cancer Care, where parties can connect with licensed social workers to address financial, emotional, and practical challenges that face our stomach cancer community. Prior to that, in 2020, we launched our COVID resource program, which continues to date. The pandemic, as many of you know, has brought specific challenges, especially for the stomach cancer community. We're proud to provide COVID educational webinars, free COVID kits, meal delivery services through Instacart, as well as launching the Mind, Body, Spirit Mental Health series on Facebook Live. Next slide. All of our program is reviewed by our esteemed Scientific Medical Advisory Board. Also, our members host educational webinars and contribute to our symposia events throughout the year. Next slide. Even though many of our year-round fundraisers were postponed or delayed due to the pandemic, we continue to work through some of those issues around social distancing and continue to host many outdoor golf tournaments in communities throughout the country. The Fayetteville, North Carolina Tournament and Charity Dinner, the Susan Reed Scholarship Fund and Golf Tournament, the Wisconsin Golf Tournament and Charity Dinner, and the Debbie's Dream and Broward County Medical Association Golf Tournament were all hosted annually in support of our mission. Thank you, everybody, for listening and taking the time to join us here today. For more information about Debbie's Dream Foundation, you can always visit our website, www.debbiesdream.org. Next, Brittany Starks will be speaking to you next.
Good afternoon, everyone. Thank you all for being here. You all were so attentive. I was watching you all the whole time. So hopefully we're keeping you interested, because stomach cancer is definitely an interesting topic. If you can go to the next slide for me. Oh, I'm sorry. So today I'll be sharing, again, my name is Brittany Starks. I'm Communications Director for Debbie's Dream Foundation. Today I'll just be sharing briefly some stats and statistics on health equity and inclusion, and pretty much how Debbie's Dream Foundation is playing our part. I gotta get used to this microphone, y'all. Okay, here we go. Next slide. So you might have heard a little bit earlier, Andrea used the acronym BIPOC, B-I-P-O-C. So I just wanted to share a quick definition for you from Merriam-Webster Dictionary in the YMCA, that it's Black, Indigenous, and people of color. And it's usually used to help recognize how this community of people are severely impacted by systemic racial inequalities and injustices, and namely in healthcare. Next slide, please. So what are healthcare disparities? So healthcare disparities can refer to the differences in access to healthcare based on race, ethnicity, sexuality, gender identity, income levels, age, and more. So some of these issues are built into systems and organizations. You can recognize health equity disparities when you see statistics like what I'll be sharing in a moment. Some examples here included the 2018 census that showed that Latinos had the lowest rate of overall health insurance. Another example may be when a patient is treated differently based on stereotypes or assumptions made by healthcare providers. Here they share an instance of where a provider may recommend a patient discuss getting their affairs in order or end-of-life care with their family. However, that patient may come from a culture where speaking of death is taboo, or we don't really talk about that, right? So that patient may come from this kind of culture, and issues such as these may limit access to healthcare or other resources that could be potentially beneficial to these patients. So since 2020, these issues have come to the surface and drawn more attention with some of the systemic issues that were prevalent. And so DDF, we're working to explore how we can be a part of that solution. Next slide, please. So now I'm going to share just a few basic stomach cancer facts. I will give a disclaimer, I am not a medical expert, so I won't be able to answer many questions, so I'll briefly go over this. Next slide. So stomach cancer is stomach is a part of the digestive system. Basically, we know it breaks down our food, absorbs nutrients, and removes waste from our bodies, right? But most cancers, when it comes to the stomach, starts in the lining of the stomach. So it's one of 5 main layers. So when it's typically stage 1, it'll be in the first layer of the stomach. And they tend to develop really slowly over many years, but they're often diagnosed in later stages. Next slide, please. So some other facts is that usually if it's early stage, it hasn't grown beyond the first layer of the stomach wall, and it's often a small tumor. So advanced cancer is usually spread beyond the first layer of the stomach wall and beyond, and maybe in the lymph nodes as well. And another fact is that cancer can spread into other organs through the blood or lymphatic system. So these are just some basic facts on stomach cancer, but you can definitely learn more on our website, which is like an encyclopedia for all things stomach cancer. Next slide, please. So I wanted to play like a little game. It's not really a little game, but did you know these statistics? And I'm going to guess that most of what I might share you may not have known, but I want to do the opposite. So if you did not know these statistics, I want you to raise your hand. So instead of did you know, I'm going to say how many of you did not know these statistics. I want you to raise your hand, okay? So next slide, please. Did you know in the U.S. stomach cancer is more common in Hispanic Americans, African Americans, Native Americans, and Asian Pacific Islanders than it is in non-white Hispanics? Raise your hand if you didn't know that. Yeah, I didn't know that either. Next slide, please. Did you know that Hispanic Latino patients have a higher incidence of gastric cancer and worse cancer-related outcomes compared to patients of other backgrounds. Raise your hand if you did not know that. I did not know that either. Next slide, please. Did you know that nationwide, people of color are twice as likely to develop stomach cancer? In 7 countries served by Duke Cancer Institute, the incidence of stomach cancer among African Americans is 3 to 4 times that of whites. Raise your hand if you did not know that. Did not know that either. Next slide. Did you know that Black or African American men are 1.8 times as likely to have stomach cancer as compared to non-Hispanic white men, and 2.5 times more likely to die from stomach cancer? Raise your hand if you did not know that. Did not know that either. I learned as I was putting this together. So next slide, please. Did you know that Black or African American women are twice as likely to be diagnosed with stomach cancer, and they are 2.2 times more likely to die from stomach cancer as compared to non-Hispanic white women? Did you know that? Raise your hand no if you did not know that. Nope. Next slide, please. Did you know that American Indian, Alaskan Native men and women are 30% more likely to have stomach cancer than non-Hispanic white men and women are over twice as likely to die from the same disease? Raise your hand if you did not know that. Nope. Next slide, please. And here's another statistic. Did you know that stomach cancer incidence among Asians is highest among Koreans, followed by Japanese and Vietnamese, reflecting that worldwide stomach cancer rates are highest in Korea? Raise your hand if you did not know that. Did not know that either. And because of this statistic, we're actually going to be doing a symposia in June in Korea, working with the Asian populations from China, Japan, Korea, and also partnering with some supporting organizations worldwide on a symposia, because stomach cancer is really high in Korea, in Asian populations. Next slide, please. So a couple weeks ago, we actually attended a workshop on health equities and disparities, and I heard this really good quote, and I just wanted to share it with you all today. And it's pretty much that health equity, it's a question that we all ask, like, how can we solve this problem, right, collectively? So the goal is to not only just define it, but also demonstrate it. So health equity is an aspiration. It's something we aspire to do, right? It's an ideal that we must strive for. We can create a framework to help chip away at some of the issues by providing solutions that hold organizations accountable. So it's not something that you're going to solve with just one solution. It's something that each person, each organization, whatever you're good at, whatever you bring to the table, as you do your part, little by little, we're chipping away at those issues. Next slide, please. And I just wanted to share here, since there is no one solution that will solve issues of health disparity, Debbie's Dream Foundation is doing our part to help educate the BIPOC community. Some of our resources include translated brochures and stomach cancer fact sheets, which you all were able to get today. In addition, we have a clinical trial matching service that's found on our website, where we highly encourage members of the BIPOC communities to explore and see what treatment options are available, as well as what studies are available. A lot of us don't take advantage of clinical trials, right? These are research studies that are being done that are exploring what's not available to you over the counter via prescription or through your doctor, typically. In addition, we host webinars and symposia to highlight some of these issues with experts who work in the field. And so these experiences help challenge them to find ways to help close the gap in healthcare. And lastly, workshops like today. We want to meet people right where they are in their communities to make sure that they know about Debbie's Dream Foundation and these resources that we have to offer. So we're really appreciative that you all showed up today. Next slide, please. And you probably saw in the video earlier that November is Curing Stomach Cancer Month. It's actually Gastric Cancer Month, Gastric Cancer Awareness Month, but Debbie's Dream Foundation started an initiative where we coined the term Curing Stomach Cancer Month, and it's pretty much to help raise awareness about gastric cancer across the U.S. So it involves a simple process of reaching out to your local lawmakers in a letter and requesting that they have the month declared as Curing Stomach Cancer Month in your respective state. So we're all here in the state of Florida. So to learn more about that initiative, and you saw a little bit in the video, you can visit our website. Next slide, please. And now I'm going to hand over the presentation to our Health Equity Program Chair and Board Member, Elkin Alfred. She's going to tell you a little bit more about her.
I'm pretty loud. I don't need the microphone. Yeah, you do? Oh, okay. I hate the microphone, by the way. So this is going to be interesting. So this is going to be a conversation. I had like slides, but I really want us to be in conversation. I like to create co-learning spaces because I want us to learn from each other. So I'm not only here to teach, but I'm also here to learn. So we can go back to Debbie's Dream Foundation and make our organization more accessible to a diverse community. So before I even get into that, I'll share with you how I got involved. I don't know how long ago it was, maybe 6, 7, 8 years ago. I went to a program for young professionals who wanted to serve their community, who wanted to sit on boards. And I met a mom who spoke passionately about her daughter starting this amazing organization, and she got me. She spoke so highly of her daughter. And so unfortunately, I was not selected, but sometimes people say no and God says yes. And maybe a year later, I got the invitation to join the board. And it was really a transformative sort of experience for me because I got an opportunity to learn about stomach cancer, but I also got an opportunity to serve alongside some amazing folks, right? And Debbie is one of them. I speak about her like as if in the present because I think she's still here because her work, right? Still, her work is here and we're doing her legacy work. So I speak about her as in the present. And that's intentional on my part because I want to honor her and honor her family because she did this in the midst of her diagnosis. And I can't imagine starting a thriving organization in the midst of a new diagnosis. So I wanted to honor that. But you heard a lot of facts today about stomach cancer, about the inequities that exist. But I want to talk a little bit about why they exist. And so the next couple of slides, I'll really focus on that. So let me know if you're familiar with social determinants of health. Okay, so social determinants of health are, I think, about 5 to 6 categories that impact our physical health. Oftentimes, when we talk about our physical health, what do we think impacts our physical health? What we eat, yes, we talk a lot about that. What else do we talk about? What we drink, exercise, yes. Stress, okay, yes. All right. I'm so happy you said that. Oftentimes, we talk about the 20% that impacts our health. So like the 20% that impacts our health is diet, nutrition, right, and physical activity. But there are a whole host of things that impact our accessibility or to disease, right? And one of the things is environment. So where do you live? How is that environment built? What's in the air in the environment? So I know for this particular zip code, there are going to be higher incidents of asthma. I know that just because of what's in the environment. And so when we talk about health and why health inequities exist, we can't just talk about our individual choices, right? So when you go to the doctor's like, well, you're sick because you're not doing X, Y, and Z. And no one is taking into consideration, well, maybe I'm sick because my neighborhood doesn't have access to fresh fruits and vegetables. Maybe I'm sick because my neighborhood has poor air quality. Maybe I'm sick because I don't have a nice park where I can take my kids to run and play, right? So we have to think about all of those things. Maybe I'm sick because I'm a black woman. and how the medical professionals treat me impact my ability to access quality care, right? So when we look, and today's presentation is really focused on stomach cancer, right? That's why we're here. But I also like to talk about other health inequities just to sort of bring it home, right? So I'm in a room full of beautiful Black and brown women, right? I know that it doesn't matter my education and my income level, but because I'm Black, I'm more likely to die during childbirth. Why is that? Because of care, because whether or not a physician or a nurse is going to believe me when I say, I feel this pain that doesn't seem right, and for the nurse or the clinician or the doctor to say, it's in your head, or let me just prescribe you this for pain and never really address the cause, right? And we have examples of that. We can talk about Beyonce, who talked about her childbirthing experience. Serena Williams talked about how she had to basically force the nurse to pay attention to her body. So this is someone who has all the money, right? Can advocate for herself because of her position, yet she still experiences. So when you go back to your community and you are, how many health navigators are in here? So we have a few. Like, your role is really important, right? Because you're advocating alongside with your client or your consumer. And so how do we equip people to be able to go back into their community or to their doctor and say, no, this is what's going on. And I know you're the medical professional, but I'm the professional of my own body. I've lived with this body, so I know when something feels right, and I know when something feels wrong. Okay? You can go back to the previous slide. Thank you. All right. So I talked a little bit about it. So healthcare quality, that's what I just spoke about, right? So the quality of care that we're receiving. I talked a little bit about your neighborhood and your built environment. Do you have parks? Is there good air quality? Do you have access to transportation? Education access and quality. Why do you think education is important as it relates to our health care? Yeah, informed in our ability to understand what the physician or the clinician is saying, right? And then obviously economic stability, right? So our ability to be able to pay the copay, right? So many of us I know who delay going to the doctor because the copay is too high, right? Or your medication. You wanna be adherent, right? You wanna take your medicine every day, but if you don't have the funds to buy your supplies, then you're not gonna be adherent to what your physician is telling you to do. So these are all the reasons why health inequities exist. And then the layer that I sort of talked about, and I think Brittany also highlighted, is our identities, right? Whether or not we speak another language impacts our quality, right, care, and our ability to understand documents that physicians will send to us. Also our gender, right? I know that women are more likely to die of a heart attack, right, because the symptoms don't show up. Our sexual orientation impacts our ability to have access quality health care. So when you are back in your community or you're going to your physician, those things are important to tell the doctor, right? And as a health navigator, it's important to consider those things when you're helping your patient navigate the healthcare system. You can go to the next slide. Oh. Oh, sorry. Is that better? Do you want me to turn off the mic? Oh, okay. Okay. You can go to the next slide. Keep on going, because I sort of covered all that. Keep on going. Next slide. Continue to go. Go. All right. So this is a little vignette. So I didn't print out my paper, but I sort of know the story, and I want you all to tell me what you think is right, what you think is wrong, what you would do in this after I explain what health, social determinants of health are, all right? So Suzanne goes to the doctor. Suzanne is 58 years old. She's complaining of stomach pains and migraines. During her visit, she talks about how she is not feeling well, and it's been going on for maybe 7, 8 months, right? She hasn't been feeling well. So the doctor just asked, okay, on a scale of 1 to 10, what is your pain? You know, the usual question. How long? Okay, and then the doctor says, okay, well, I'll just give you a medication. Follow up with me in 3 months. So, based on what I talked about, what did the doctor do right? What did the doctor do wrong? How would you change this interaction? Mm-hmm. Right. Yeah, because one of the things Brittany talked about earlier is that, right, when we look at Black community or Hispanic community, we have higher incidence of stomach cancer, but we're also more likely to die, right? Probably because of late diagnosis, right? And that's because you're right. So why not take the extra step to make sure Susan goes to get that exam? Yes. Yes. Yep.
Be persistent and, demand it. No, because me personally, all my tests came back negative. And he told me to go home for 6 months. I said, doc, something is wrong.
Yeah.
And we need to do some other things. So we have to be more conscious about our body and be persistent.
And for the health navigators in the room particularly, it's important to encourage your patients to do that because some people culturally, it is not easy for them to second guess the physician, right? We're told to just trust. So it's important to acknowledge that we have to encourage each other to do exactly that. She canceled you? And that's fine. You find another physician. Yes. And what I love about Debbie's Dream is that there's this peer network, right? Where you can talk to someone and say, did this physician work for you? Right? And so create that in our own community. Talk about which physicians that are more likely to listen to us. Yeah. Yes, yes. Wow. Wow. I'm sorry to hear that. Mm-hmm. I'm sorry to hear that. Yeah.
And when I don't know if it was the colonoscopy or endoscopy, but because I was diagnosed doctor. So, you know, I don't know what they did different, but by the time they found that he was dying.
Thank you, sir. They're right here and in fact. I just like to say that's why it's so important what you're doing today. You have to self-educate yourself. A lot of doctors are not up to date on the latest treatments, the latest education. You can't rely on someone, you gotta rely on yourself. You gotta be persistent, like you say. And it's so important because we as a people, we like to leave the responsibility to the doctor. No, it's gotta be your responsibility. With today's technology, we can learn so much about ourselves. Some doctors don't even have the time to follow up on the latest.
Some don't take time.
They don't have time because look at today's practice. They don't have time to even write notes, you know, and put in your file. Some doctors don't even write notes in school. They don't know that. You know, so it's just so important that you do what we're doing today, so self-educate ourselves. And when we know we feel different and it's not a normal feeling, be persistent, you know? Yeah, because it's not their life and health at risk.
Exactly.
It's yours.
So, one thing I just want to add, and I know I'm at the back of the room, so you don't have to turn around, I'll try to project. One thing in that situation, and one thing I try to tell my clients all the time through the health navigation program, is if you go into the doctor's office and you are complaining about something, can you guys hear me better now? Okay, if you go into the doctor's office and you are complaining about something and the doctor says, okay, I'm going to give you this medication, I'll see you in such a while, tell them that you want it documented in your file that you complained of these symptoms and they did not run any tests, and I promise you, watch how quickly they change their mind. Right? So, especially as people of color, as Black women predominantly that are sitting in this room, Elkin touched on it. There's a lot that happens in the medical care system where our care falls to the wayside, but if a doctor has to be nervous that something might happen to you and there's a note in your file that says you were complaining about X, Y, and Z, and they chose not to do anything, they have to consider their medical license now. They have to consider what the ramifications of that would be. So whenever you go into a space, do not hesitate to advocate for yourself. I'm 30 years old. I know you guys see my neck burst on. Got into a car accident, and I had to fight my doctors to get an MRI of my upper spine. He's like, oh no, those injuries are so rare. We doubt it's that. I literally had to fight him. Told him I wanted a full spine MRI. When I got to the MRI facility, guess what he submitted? Just the neck. So I'm at the facility for my appointment, had to call the doctor's office and fight with the doctors to send over the correct thing, right? So like Elkin said, nobody is gonna take care of our healthcare for us. It's up to us to learn how to advocate for ourselves. And we have an awesome team of navigators. I'm not gonna hijack the presentation, but we'll talk about that later.
And also, when you go to the doctor too, they always tell you, oh, we're gonna do blood work for this. No, I want you to do a full, thorough blood work. I want you to check everything, because sometimes they just check certain things, but they don't check everything. So if you're saying, oh, I'm like extremely cold, they're gonna write a prescription. Oh, you just need iron. You're anemic. And guess what? It could be something else. Me personally, I'm a community health worker, some of you know, but I have thyroid disease. That's one of the symptoms of my thyroid disease, you know? And next thing you know, you at the doctor and the doctor saying, oh my God, we may have to give you a blood transfusion. And I'm, what? But you have to let your doctors know, no, I want you to do everything, all the blood work. Don't just limit what you think I need. No, do a full blood. I need you to do everything. And they'll do it. And like Ms. Shamel said as well, have them notate everything that you're saying. And that's what they did with me, and that's how they found other things as well. So, yeah, thank you.
Hi, everyone. And also, to add to that, I just want to say PCPs are not specialists. Your primary care doctors are not specialists. So if you're complaining of thyroid, your heart, your kidney, whatever it is, see a specialist and don't let your primary care handle that. Thank you.
All right. So, because I want to be mindful of time.
Quite a while, leave primary leaves, and then go to a new doctor. My doctor would always call me. Well, just give the assistant the results of my blood work, and then it let me know what's changing and what is changing. But I'm having a problem with her. She giving the assistant my results, but they're not changing. So she said, I'm going to see you in 6 months. I know you're going to see me in 3 months, but now I'm going to her next week. Thank you.
Awesome. All right, so I want to be mindful of time. One more, and then we got to move forward because I think we're supposed to be done by 1. Yes. I think probably Andrea, Brittany will be able to answer that question. As it relates to stomach cancer diagnosis, is there a particular... Yeah. The next slide. So I had a scenario where my godmother, she was very on top of her health. She had an endoscopy, but then she got sick and she couldn't eat anything a year later. And they were saying, well, you just got an endoscopy. So she got misdiagnosed for several months before they found out she had stage 4 stomach cancer. And by that time, it was too late. So she passed like 2 months later. Wow. So you want to get an endoscopy so they can get in there and see what's going on. All right. So, and I want to be respectful. I'm sorry I'm rushing this, but I want to be respectful of the time. So I just shared earlier the first vignette with Suzanne. Now, this is one with a doctor who's a little bit more thorough, right? So again, her age, her level of pain, but the doctor also asked her about what's going on at home. Because remember I talked about our social determinants of health. So not only our nutrition impacts our health or our physical our physical activeness, but also the community in which we live, right? Do we have a stable job? Or do we have a job that allows us, that gives us PTO so we can go to the doctor, right? So this physician asked about family dynamics, because earlier someone said stress impacts our health too, right? Are there stressors at home? Do you have access to fresh fruits and vegetables? Or do you only have the corner store in your neighborhood? And then, so what the doctor did was, let's partner you up with community support. Let me make sure that you're connected with a health navigator that can make sure that you have the benefits that you need, whether it's access to fresh fruits and vegetables, whether it's transportation to make sure that you get to your medical appointments consistently, or it could be if you have family stressors at home. This particular, I'm not sharing her full story, but she was taking care of an older parent who had dementia. Will that cause stress? Will that cause you to be sick? Yes, right? So the health navigator now is going to make sure that they're connected with respite care, right, for their family member. And then educating them about how does this change your lifestyle? What does this mean for you, right? What fruits and vegetables should you be eating? What things should you avoid to eat? So this physician was more comprehensive. And so the social determinants of health really forces us to look at outside of just the individual behavior, because we know that does not impact our overall health. Right? We know multiple things play a role in our ability to survive stomach cancer. And so a few things that I want to leave you with, you can go to the next slide, is what you can do to help, especially for our health navigators. DDF has partnered with United Way, and we're sharing this free resource. It is a health equity program. It is a 5-6 week program for clinicians, providers, healthcare navigators. You will receive CEUs. And again, it's a free program around social determinants of health. What can healthcare systems do and communities do to elevate the health of everyone, because that's what health equity is. And then you all talked about it, is address the power dynamics that impact quality care, right? So you talked about advocating for yourself. Encourage each other to do that. So when you leave this space, you hear that Jane has an appointment, follow up and say, hey, Jane, I heard you had an appointment. When is your next follow-up? And then in 3 months, say, Jane, did you go? Let's hold each other